For the last 2 years, specialist community workers called Community Champions have been delivering a new approach to tackling health inequalities in deprived areas and targeted communities in Kirklees. They work alongside professionals from the local Health and Care Partnership.
As a Kirklees ICB and the wider Kirklees Health and Care Partnership, ever since our foundation, we've said that reducing and trying to address inequalities is our overarching aim.
There are a lot of people who don't engage with traditional healthcare in traditional settings. The Community Champions are a really crucial way of us reaching those people, engaging with them.
I think that Community Champions are massively important simply because they're out there in those communities, they know those communities well.
Having that mechanism with the Community Champions in there is really, really important in how we can do that.
The champions, recruited directly from the communities that they work with, are employed by 15 different community organisations like Local Services to You. They get involved in whatever activities they're delivering.
Today we're calling it the Chestnut Centre Fun Day. We've got lots of fun activities, we've got all sorts of things to get people in, to get people along, but also at the same time we've got a lot of agencies and organisations. So we've got a flu clinic and COVID vaccine clinic, we've got health checks, we've got the immunisation van, just so that when people come in, if they want to pop in and get their jab done, if they want to get that health information, they can do that at the same time as well. Community champions are good talkers, we find. So, they'll go up to anyone and have a chat and start a conversation.
So we just start some conversations. We have given them an environment where they feel safe and where whatever they can say, and they can get some advice as well.
We'll go for walks, we do yoga, we provide lunch, and then in all these sessions we talk about what we are concentrating at the moment.
They receive specialist training on a topic before delivering a 6 to 8 week campaign in their community.
We've trained over 20 topics by now. It's diabetes, asthma, stop smoking campaigns. We've been doing menopause as well. So there are a lot of like vaccination, immunizations, a lot of things we've been doing. So
smaller groups like the Rural Veterans Group can also get involved by including Community Champions work into their normal activities.
I think on Tuesday we've actually got somebody coming up to talk to us. He's a musician and play a few songs and that, but we've also got, sat at the back of the room, somebody coming to do blood pressure checks and to do blood tests for diabetes.
Because they've been doing lots of different campaigns, they now know a huge amount about health, about services that are out there. So they're kind of a bit of a walking library of information.
The impact of that Community Champion is just them conversations and having those people with lived experiences and with also in similar circumstances to them.
We find that definitely people learning from the peers and people in the community makes a massive difference with confidence of people coming forward and accepting vaccination.
The champions speak 19 different languages and use their own lived experience as refugees, survivors of domestic violence, of disability, and as people from a mix of cultures and backgrounds to connect with people and get them talking.
When you speak their own mother tongue, this for me, like I use my knowledge and my language to help the people. Yeah.
I recently lost my mom with a liver cancer. So I always go out and help people and tell them my experiences, how it happened with my mom and how we able to help her.
The Community Champions, as well as going out and sort of giving information to people in our communities, they also bring a lot of information back to us.
We're getting real-time information on the issues and needs within the communities we work in.
When you hear them talking, it really resonates, because they're kind of talking from the heart and from their own experience, and I think that's what helps to make a difference and absolutely helped me in my role understand how we could deliver the programme in ways that made it accessible to more people.
So the Community Champions are people of their communities, they are trusted, and they are far better placed to engage with those folk than we are.
I want to give back to the community.
The knowledge and experience you get, you support other people.
So they add a huge amount to what we're doing.
The impact could be huge. It could be ultimately life-saving.